enter the room.
Thank you. Good morning. I'm Dr. Khalil, and I'm working as one of the junior doctors in this department. Am I talking to Jenna Kaplan?
Yes, doctor.
Is it fine if I call you Jenna?
Yes, doctor.
Thank you, Jenna. Could you confirm your age for me, please?
I'm 28 years old.
All right, it's nice to see you. What can we do for you today?
So doctor, I'm here because I have a lot of pain in my breast.
Okay, don't worry, Jenna, we'll take care of it. Could you tell me where the pain actually is?
It's in my right breast.
Could you point your finger for me on the area?
Yes, doctor, it is here.
Okay, thank you, Jenna. So could you tell me how the pain started?
It's been quite a few days, but since yesterday it has worsened so much that I just came here.
Oh, don't worry, we'll take care of it. Jenna, could you tell me, has the pain, is there anything that has made the pain worse?
Yes, doctor, it gets more intense when I'm feeding my baby.
Okay, and how long have you been feeding the baby?
Yeah, my baby is 1 month old, and for the last 1 month I'm feeding him.
Okay, so you just delivered a baby.
Yeah.
Okay, Jenna, could you tell me if there's anything that makes the pain better? Have you tried anything?
No, doctor.
Okay, we're here to help you. Don't worry. Jenna, could you tell me if you have any other symptoms or any other complaints?
Yes, doctor, I noticed some swelling as well on the breast, and I'm feeling a feverish as well.
Okay, and it's only in the right breast, am I correct?
Yes, doctor.
Okay, and you mentioned fever. So, did you record the fever by any chance?
No, doctor, I haven't recorded it.
So you just feel feverish. Is that correct?
Yeah, and I feel tired as well.
Okay, okay. I can understand it can feel very distressful. Don't worry. With the right treatment, we'll be able to find something for you. I'll just like to ask a couple of more questions regarding your general health. Are there any other medical conditions that you have?
No, doctor.
Okay. And is this your first and only baby?
Yes, doctor.
Okay, and could you tell me if you have taken any medications or have any allergies?
No, doctor.
You mentioned that you do not have any allergies.
Yeah.
Okay. I would also like to ask you if you had taken any antibiotics early on after your delivery.
No, doctor.
Okay. So um, for the swelling, I want to ask, did the swelling start with the pain?
Yes, doctor, it's with the pain.
And how long has it been there for?
Yeah, it has been there since the pain started.
Okay. I would just want to ask you if there's anything else that's worrying you or anything that's in your mind.
Yeah, doctor, because of this so much pain for the last 1 week, I have put my child on the formula milk, and I'm so much feeling guilty that I'm not able to feed the baby.
I understand. So, it can seem distressful since it's your first baby, but don't worry, we're here to help you, and we'll take care of you and the baby. Has the baby experienced any symptoms?
No, doctor, I'm also actually very worried that if he also catch any fever from me, but I'm just preventing it.
How long have you stopped breastfeeding from?
4 to 5 days.
Okay. Is there anything in particular that you're expecting from us today?
Yeah, I'm expecting some painkillers and also to treat the swelling and the fever.
Okay, of course we will. We're here for you, and we'll do that for you. Just before I do that, I'll just quickly like to examine you. I'll be quick. Please let me know if you experience any pain while I do that. I would just like to take your blood pressure, your heart rate, your respiratory rate, and your temperature to assess if you have fever as of now. I'd also
Okay.
like to examine your breast if you're comfortable in exposing that for me. Is that okay with you?
Okay.
Okay, Jenna, thank you. So from your examination and from what you've told me, I can see that your right breast is swollen. It seems hot to touch, and I can see a certain redness near the nipple. This is rather common, so you do not need to worry. I can reassure you that with the right treatment, we'll be able to cure you, and you'll be fine very soon. So I see you have experienced no discharge.
2 minutes remaining.
You've experienced no discharge or pus. So I will like to tell you that you have a condition that I believe is acute mastitis. Have you heard of it, Jenna?
No, doctor.
Okay, so to simply tell you, it's basically the inflammation of your breast tissue. This can very commonly happen in breastfeeding moms, and it's something that can be treated with antibiotics. So I will be giving you, firstly, I'll be giving you some antibiotics, um, and that will help you with the swelling and temperature as well, and the pain should get better. I'll also be giving you painkillers, and I just want to make
Mm,
sure. Yes, please. Do you have any questions?
Which antibiotics are you going to give me?
So we will give you a penicillin. But I've noticed from your documents that you're allergic to that. So we will be replacing that with another other antibiotic that works for you. Is that all right?
Okay, doctor.
Thank you. Are there any other questions that you want to ask me at the moment, or am I clear to you so far?
Thank you so much, doctor, for your approach.
Okay. Jenna, I would also like to give you certain leaflets that will help you understand what you are going through, and to make sure that you do not feel like you're affecting your baby with it, because I can reassure that your baby will not get affected or not catch fever from you. Am I understandable?
Yes, doctor. Thank you.
Okay, I also want to tell you that please keep an eye if you experience any discharge, or if your pain progresses, please report to the emergency department as soon as possible so that we make sure that you're okay.
Move on
And
to the next station.
All right. Thank you so much, Dr. Maha. Good job. Good job. Don't worry about it. All right. So let's understand what were the different issues in this consultation.
okay.
So would you like to start off on what did you identify as the issues in this consultation? What was the main issue?
Well, she had pain in her right breast, and
Good job on that. So that was a presenting complaint. So always treat the presenting complaint. You gave something for the presenting complaint, yes. And
then she had swelling and fever, and she wasn't able to breastfeed the child.
all right. Yep. Anybody else for the issues? Anyone else wants to? So would you be feeding the child in case of mastitis? Would you actually breastfeed the child?
No, 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 you're not actually supposed to do that.
Why not?
I think we have to carry on breastfeeding.
Right. Good job, Dr. Anam. Yes, we will continue breastfeeding. Why does
Because I think
uh,
this is breast abscess forming, and we have to carry on breastfeeding with it. We don't have this is like not a contraindication to
Yeah,
breastfeeding,
right. Yeah.
but it helps. Basically, it helps.
yes, absolutely. So, why does this mastitis even happen in the first place? You mentioned that, the mothers who have just recently given birth, they kind of experience this. Why? Could you tell me a little bit about why you understand this, this kind of a condition, this inflammation would happen?
So it happens because of some bacteria, Staphylococcus aureus, due to breastfeeding, maybe.
Partially. So usually because of the milk spaces. So in case of engorgement, mastitis, abscess, especially after postpartum, there will be a very classic history of how is your feeding going. So they would actually say there is some latching problem. I haven't been, that consistent with my feeding. My child does not really latch on very well. I find it very difficult. He's on formula. So whenever you see that there is an inconsistency with, in the history for feeding, and there is breast pain, you're going to, make that connection. There is going to be a related stasis of milk that is causing their symptoms. So how is the progression? Initially, it has been going on for about a week, and then now all of a sudden, since yesterday, it got worse. So it started with engorgement, progressed to mastitis, and then the sequelae for getting worse is an abscess, and you are going to have to stop it before it actually goes into that phase. So what is the mainstay of treatment?
Breastfeeding.
Yeah.
Basically, you have to express out all the milk, make sure you breastfeeding, and you can, try to express all the, the milk that is accumulated. All right, so that is very important, and that is the mainstay of treatment. And then, also along with that, supplemented with antibiotics and painkillers, supportive bra, maintain hygiene, right? So all the other risk factors. Let's talk about the other risk factors that can actually be, associated with mastitis. Any cracked nipple, any trauma, ask about those history. Ask about how this is actually happening. So you have a clue that this is a breastfeeding mother. So, the most likely cause could be the milk stasis, but you can also think of other, aspects that can actually cause the infection to come in. If there has, yes. So if there has been any, breach in the integrity of the skin, because what is staphylococcus? It's a commensal on the skin. If there was any route of entry, ask for any trauma, right? So after asking all of that, try to understand how is the feeding habits. If she is not feeding, what is the child having at the moment? So remember, in PLAB 2, you're not only treating the patient, you're not only treating the disease, you're treating the patient as a whole, right? Understanding their predicaments and addressing it holistically. Right, so that's very important. So this is a new mother, so congratulate her on her recent delivery. Develop some interpersonal skill. Oh, I can see from my notes that you are a recent mother. Congratulations, how is everything going? Start asking history that way. Build some kind of a relation. You get some marks on interpersonal skills there. And ask about the health of the child. How is the child feeding if you're not so consistent with your breast milk, right? How is he growing after that, right? Because that's also your concern, if you think about it, right? So yes, let's quickly take a look at the performance. But good job. I think you managed to cover the main parts. And thank you so much, Dr. Sara, for the simulation. And there was a penicillin allergy, by the way. So the antibiotics completely change if there is a penicillin allergy. So otherwise it's flucloxacillin. Otherwise, unless they are allergic to penicillin, then you'll have to change that. All right, so let's quickly take a look. So data gathering, points that was covered. Empathetic language. Okay, I'm so sorry. I must have. Okay, full name and age. So always remember in PLAB 2, the identifiers, whatever the identifiers is, make sure to ask the full name, because even by chance, you do not want to mix up your patients. So if you have full name, ask the full name and age, because you have to make sure you're talking to the correct person. There could be another person named Jenna who might be in another consulting room, and you might accidentally end up talking to her about another person's medical, data. There shouldn't be such a mistake from your end. So always confirm full name and age, since that is the identifiers given to you, right? All right, so let's start with the covered. Use empathetic language to validate discomfort and encourage sharing, right? Like I can see that, this must be very distressing. Could you tell me a little bit more about this? So whenever you start asking questions, ask with an open-ended question, meaning give them an opportunity to express themselves fully, right? And then close it down to the aspects that you would like to know even further. right? So whenever you're starting with the consultation, always ask, I can see from, always use, first of all, the information that has been provided to you. So you can see that you have breast pain, breast swelling, fever, right? So this is the information that you have. Use it in your in your consultation so that you don't waste time. So start off by saying, am I speaking to Jana Kaplan? Could you please confirm your age? I can see from my notes that you have been experiencing some breast pain, swelling, and fever. Could you tell me a little bit more about this? You see, so it's an open question. So let them express themselves, and now then close it down to the Socrates that they haven't mentioned, the specific Socrates that you would like to know in order to make your diagnosis. Right. So let's quickly take a look at the performance again. Yeah. So check vital signs, do examination, that was good. Conduct a focused breast examination, inspect for symmetry, redness, shininess, shiny skin, nipple discharge, palpate for warmth, tenderness, wedge-shaped area or lump. All right, good job in the examination bit. Confirm name and age, that's very important. Explore the breast pain in detail, onset, duration, progression, quality, anything that makes it, what kind of a pain is it? Is it like a throbbing pain, right? Is it just a constant dragging pain, right? Understand whether it is on both breasts or just a single breast, which is it, unilateral or bilateral, right? Understand that. Ask about the local signs, inflammation, redness, warmth, tenderness, swelling, presence of any lump, right? So always in your mind, what is the worst thing that a patient can present with breast pain with? Usually, even though breast cancer usually are painless, but it's pretty much a young age, just think about a lump and try to rule that out. Right? Screen for systemic symptoms such as fever, chills, night sweat, fatigue, general malaise, that's very important, to understand how is this fever, how is this infection affecting her life, till what is it, how much is it debilitating for her, so that you can give her that much of assistance, right? Complete PMOF TOSA. Understand, has this happened before? Is this your first child? Have you experienced something like this before? Is this your first child? Do you have any medication allergy, travel history? Okay, these are all supplementary. If you have time, you ask, but not very important in this context, right? Understand lifestyle habits at this point, right? If she is currently smoking or drinking, but always signpost it when you're actually asking such invasive questions. And then specifically, what about the pain that you need to understand, right? What is the pain due to, right? Understand the etiology of the pain, right? How is the feeding going? Was there any trauma? Was there any injury that you sustained, right? Ask about any nipple discharge, right? So you know that there is milk coming out. Okay, wait. Yeah, so you know that there is milk, but is there any other discharge that that you should be worried about, right? Any details about the breastfeeding, difficulty latching, frequency? Understand if there is difficulty in breastfeeding, what exactly is the difficulty? Is it the latching? Is it the position? Is it the suction reflex, right? Crack nipple, burning sensation during feeding. Ask about the baby's feeding pattern, frequency of feeds, baby's weight gain, satisfaction after feeding, any recent changes in the baby's feeding behavior. So that will be red flags that you need to, understand, if the baby is experiencing any kind of, alarming, symptom that you should address, right? Ask about any risk factors and differential any recent trauma to the breast, rash, such as dermatitis or fungal infection, or any signs of abscess. So that's very important. So you need to understand, at which phase is this? Is it the engorgement, mastitis, or is it in the abscess phase? So if it is in the abscess phase, that's when you would actually prevent or ask her not to continue with the breastfeeding, right? So, because the pus collection, if it bursts and comes into mixes with the breast milk, that would be problematic, right? Otherwise, with the mastitis itself, it's safe to breastfeed. The breast milk itself has a lot of antibodies on its own, right? And yeah, and there are a lot of documents on the safety on breastfeeding with just mastitis. Risk factors and differential recent trauma, you mentioned that. Explore red flags. So since this is just immediately after delivery, what are the different things that you would actually be worried about? Any PE, any kind of family history of breast cancer. You need to understand and rule that out quickly, right? So this person has actually come with pain in the chest technically, right? So just quickly rule out all the red flags. Explore red flag symptoms such as leg pain, swelling, breathing difficulty, family history of breast cancer. All right, management. So when it comes to management, main thing, so let's quickly look at the review. All right, so management. So always when you start with management, give the entity the name, like what is the disease, mention what the disease is, right? So given your presentation, it looks like it could be something called mastitis. Now, when you actually drop a medical name, always follow it up with a layman explanation. What is mastitis? Why is this happening? Right? Mastitis is a painful swelling of the breast, often with redness and fever, usually in breastfeeding mothers. It happens when milk isn't drained properly or bacteria enters through a cracked nipple, right? So continue to breastfeed, which helps with healing faster. What is the manage, and then draw out the management plan. So what is the management plan that I'm going to advise you, right? So breastfeeding, pain relief, antibiotics, right? And a couple of lifestyle advice. So let's go through it. So encourage breastfeeding and expression to keep the milk flowing, advise breastfeeding techniques to reduce pain, good latching position, regular feeding, try different position to try feeding. So one good way for symptomatic relief you can actually offer is just before breastfeeding, you can apply some warmth on the breast, so that the expression of the milk can be easier, and immediately after the feeding you can actually give a cold compression, right? Feeding is important because it keeps the milk flowing and prevents the breast from getting more swollen or infected. Even if the mother has an infection like mastitis, the milk itself is safe. It doesn't pass germs to the baby. In fact, breast milk has natural antibodies, that helps protect the baby from getting sick. Otherwise, pain relief, because that is a presenting complaint. Antibiotics such as erythromycin or clarithromycin due to the penicillin allergy, right? Usually for 10 to 14 days, but if it is improving well, then you would give it for 7 days. Otherwise, general advice, wearing a well-fitted bra, non-restrictive, gentle care and hygiene for the affected breast. That's very important. Safety netting, return if, and then after you've given this, what are the 3 main things that we always actually tell everybody to start doing, once you hear the 2-minute milk? This is something that I would advise everybody to follow. As soon as you hear the 2-minute bell, 3 things, try to incorporate it in your, all your consultations. That is safety netting, leaflets, pamphlets, and a follow-up. So safety netting, what are the danger signs that you need to look out for? And if you experience any of these signs, make sure to seek medical help immediately. Educational leaflets. So as of now, this mother has, okay, so we first started talking about what is the issue. The main issue with this mother is that she doesn't know that you need to express the milk in order to reduce the symptoms. She thinks feeding the baby would be dangerous. And this is a misconception that you have identified that this patient has. Address that misconception, rectify it, right? And give resources so that she can refer to, credible resources. That's why you're giving her the resources to look up information and understand a little bit more about your condition. Otherwise, you don't understand where they're getting their information from. So you're giving a very, trustable source for them to look up on, the condition itself. So always mention resources, right? Leaflets on mastitis, breastfeeding technique, additional support as well, so always keep encouraging them since they are, just a new mother, identifying that this is a new mother, she might have a lot of anxiety for taking care of the child. So always be encouraging when you're giving advice. And, further referral that you can offer is referral to the lactation consultant, that can help with the latching and feeding techniques, that can help drain the milk and prevent this, condition from occurring again, right? Breastfeeding support groups, right? health visitor follow-ups that can come home and also assist with the feeding, right? So those are other referrals that you can put and refer them to so that they can seek further advice, right? We'll just quickly look at yes. So now let's look at the management. So explain the likely diagnosis of mastitis clearly and in layman terms, include causes, symptoms, and the expected course. Prescribe antibiotics safe in penicillin allergy. Reassure the mother that continuing to breastfeed is safe and helpful, and explain why it's encouraged despite the infection, right? Advise techniques to improve milk drainage, proper latching, regular feeding, or expressing varying positions, right? Those are the advice you can actually give them. Recommend warm compression before feeds and cold compression after feeds for symptomatic relief. Discuss lifestyle advice, well-fitted bra, rest, good hydration, breast hygiene. Safety net clearly, advice to return if pain worsens. Fever persists beyond 48 hours. This is very important. Even after giving the treatment, if you feel that the fever is persisting, ask them to return immediately after 48 hours. All right, so that is the follow-up that you would follow-up and safety netting that you would be advising in this case. And also if the discharge becomes green, bloody, or any new symptoms develop, right? Arrange breastfeeding support. This includes referral to a lactation consultant, community breastfeeding groups, health visitor follow-up to help with feeding techniques, prevent recurrence and support emotional well-being. Arrange follow-up within 48 hours, review the symptoms, and ensure response to treatment. Otherwise, interpersonal skills, signpost throughout the consultation, use empathetic language and soothing language. Every time they are actually doing something, positive, encourage those things. Like if you see that, she was actually making sure that the child was getting food, since she couldn't express the milk, encourage that, like, yes, that is very supportive. I can see that, you're very concerned about your child, making sure that he gets the adequate nutrients. That's very good of you, right? So anything that you find positive in this mother's caretaking, just encourage those things, right? Ensure holistic care by checking emotional well-being, offering resources or signposting to support services if needed. Acknowledge the mother-child dyad by reassuring that treating her will directly support the baby's health and feeding. Acknowledge and validate patient's concerns. All right, Dr. Mahan, that was a good try. Good job. Do you have any questions or any doubts for me?
Thank you. I realize I missed a lot of things, and yeah, so made a huge blunder also. But I'm just curious, how can I cover so many things in, like, the time management is always an issue. So
Absolutely.
how especially in management, you're talking about so many support groups and things like that. How do we cover all of that?
I understand that. That is actually, a recurring concern with doctors who are taking this exam. So, whenever you start with, the data gathering, always start with open-ended questions so that, they can express themselves freely. So every question you ask takes a lot of time. So try to use as many open-ended questions as you possibly can. So start with, how is this affecting you? I mean, could you tell me a little bit more? Ask about the red signs. I mean, meaning any of the danger signs that can actually be life-threatening. Rule out those conditions first, right? And then understand what this could be. So, once you understand what the condition is, ask how it's affecting them. So from the presenting complaint elaboration, you're moving on to the PMAFROs, understanding the lifestyle, right? So when you're starting with that question, start with, how is this affecting you? It's an open-ended question. So that way they themselves will actually come up with, a lot of their concerns. Try using more open-ended questions, I would say, right? Only ask close-ended questions when you're trying to rule out, certain conditions, or when you're trying to understand the, the depth of their, what to say, distress. right? Use ice whenever you can. So I made a blog about how you can use ice. So I'm going to be sharing that with the group as well. And I've made a blog about this condition, starting from engorgement, mastitis to abscess, so that you get a better understanding about the progression itself, the sequel of events, right? And also, if you check out our website, we have something called the consultation guide. So this is a guide that helps you, stay on track on all the important aspects that you need to cover. So it moves with the timer.
Begin.
So if you
Enter the room.
every 30 seconds, it tells you what you ought to be doing at that time. So try using these kind of tools, try to use the consultation guide when you're actually practicing the cases. We have a few free cases that you can use, right? And coming to management. So now, if you understand that you've lost a lot of time in data gathering, you only have, say, 2 minutes or 1 minute left in management, how would you, make sure to get all the marks you can? So one good technique that we came up with is, so whenever you have a management plan, always give, start with introducing the entity, the disease entity to the patient, telling them, what this is, right? And then list out all the things that you possibly can do, and then convert it into a conversation. So I'll give you an example. So from what you have told me, it looks like you could be suffering from a condition called mastitis. I'm going to be explaining what this condition is. Along with that, I'm going to give you a couple of, pointers on how to reduce the distress. This is a condition that happens due to buildup of milk in the milk ducts. So I'm going to give you ways on how to, improve the drainage. I'm going to give you the antibiotics for the underlying infection. I'm going to give you some painkillers. Along with that, I'm going to give you some support that you can avail. I'm going to give you some leaflets so that you can understand this conversation well and refer to it if you have any doubts. And I'll set up a follow-up in 48 hours just to make sure, the treatment is working for you. And I'm going to mention some red sign or some signs to look out for. If you are experiencing any of these signs, please do come back to us. So from all of this, what would you like to talk about first? In a way, like it's like a teaching station. In like a teaching station, you give an overview of everything that you want to talk about. And then, that way you're kind of informing the examiner that these are the different aspects in management that I'd like to touch upon. Due to, the shortage of time, I wouldn't be able to do that. But so at least informing the examiner that, these are the management that you would be giving. And then turning it into a conversation where, the patient itself is conversing with you. So giving them an option of what they would like to talk about. And then moving forward with a normal conversation. Does that make sense?
Yeah, that actually makes a lot of sense. Thank you.
So that is one thing that you can employ in your consultations, but always try to understand that, there is equal weightage for data gathering as well as management. So try to data gather as soon as possible. Once you've actually managed to understand what the underlying disease is, move on to management. Right. So your entire purpose is to understand what the disease is. Once you've understood that, understand the impact of that disease on the life, and then move on to management as soon as you can. Right. Because you have a lot to cover there as well. So try to allocate your time that way. So I would also like to show other features on our platform. So this is made by me, Dr. Ann, and Dr. Rohit, who we have recently passed our PLAB 2 last year. Thank you so much, Dr. Sada. And we have made this platform for all of you guys, who are working in different countries and find it so difficult to, come to another country and, learn cases and practice. So we have made this so that, to facilitate online practices so that you can practice with a partner like how we are doing on our calls. So it has 2 modes where you can review the case, where you can understand every single case by its approach, its data gathering, management, and interpersonal skills, all the different aspects that you need to cover here. Or you can go into the review mode where you can review with the partner. That's what we have been doing in the practice sessions. Or you can review a practice with an AI. So if you don't have a practice partner, this is something you can use to practice. So we've managed to incorporate an AI for all 555 cases that we have on the workbench,
Begin.
starting with a 1.5 minutes of reading time. Either you can wait for 1.5 minutes or you can enter the room,
Enter the room.
where you will come face to face with your simulator. So you have 8 minutes of consultation time, and to begin your reading, you will have to click, to begin your practice, you will have to click the microphone button. Hi, my name is Dr. Anne. I'm one of the doctors in GP surgery today. Am I speaking with Jenna Kaplan?
Hi, Dr. Anne. I'm Jenna Kaplan.
Thank you, Jenna. Could you please confirm your age for me?
I'm 28 years old.
Thank you for that, Jenna. And I can see from my notes that you've been experiencing some breast pain, swelling, and fever. Could you tell me a little bit more about this?
Yes, I've been having a lot of pain and swelling in my right breast. The pain is really throbbing and gets worse when I feed my baby.
So that is the patient GPT, guys. So you can have an 8-minute conversation with the AI itself, and you can have the entire 8-minute conversation, or you can end the session and check out the evaluation. So the evaluation is the same checklist that we used for our case before, and from the conversation that you have had with the AI, it captures the conversation and marks it against all the points that have been mentioned on the checklist. So let's just quickly take a look. So that's for data gathering, management, and interpersonal skills. So depending upon areas that are covered, missed, you get an appropriate score for that. And all your sessions gets logged according to date and time. So if you see the entity that you practice with comes as a robot face, or if it's a human that you practice with comes as a silhouette. So all your practice sessions gets logged so that you can have an idea of how each practice session has gone and where your strengths and weaknesses lie. So that is a patient GPT, guys. And so for everybody who is been attending our calls, we are offering a 20% discount on all the Bain brand products. And I'm going to ask the examiners to put the coupon code so that you guys can get your own patient GPT subscription.